before Kimla will go, just while we're waiting for people to gather. So Salome sent a wonderful question, so I'm just going to read it because it's just easier that way. After vaccination, do we need to continue to take immune boosting protocols such as increased zinc, glutathione, etc.? So that's a really good question. So, and the question gets to a point of the risk, right? And it also ties into what I was going to mention today anyway. So my part for today was, I'm going to put this link in because it kind of ties into this question really well. Let's see. So I'm going to put a link to a US Today article about updated information about Pfizer vaccine in the chat. So you guys can take a quick look while I'm, while I'm answering the specific question. So it really depends on what the goal of the protocol of support is. When the disease started, we had nothing in terms of prevention or control of the illness. And the idea of trying to optimize nutrition, doing the preventive supplements, et cetera, was to basically optimize the immune system so then if you do get sick, that your sickness is mild. Or literally decrease chances of actually getting infection, because the idea would be if your immune system is strong enough to respond to the virus at the entry, then maybe you can even become completely asymptomatic. So with the vaccine efficacy, especially given this new finding of Pfizer vaccine, that it does appear in in Israel to decrease transmission. They actually have now published an actual study demonstrating that. And I think it's quite an important data, because the idea has been that even though we know in the trials the vaccines have prevented severe disease and also death, we didn't know if it prevented the actual transmission, but it does appear so, at least for now. So with that sort of in context, how essential is the support? Yeah, it's becoming less essential. I think it's becoming more important to start relying basically mostly on nutrition, and the supplements in that case should be much more targeted, meaning that if you have a low immunity for whatever the reason, and in consultation with your provider, I think you can then decide if specific nutritional support would be important. But you also need to think of sort of, do I just stop everything, or do I begin to kind of slowly titrate down some of these products one at a time? Like, for example, zinc, you know, if I've been on zinc for 6 months, should I continue it? Is my level is now, where is it? I don't think there's a really clear universal answer. I would say that if you are doing quite well and if you simply want to stop the zinc, it's probably okay. There's also absolutely nothing wrong to simply continue if the dose is not extremely high. We talked about zinc to copper ratio in the exact example of this. And I think the same goes for the immune boosting herbs as well. So, you know, there's also summer coming, and generally speaking, in summer, you know, the vitamin D and sun is a little better. So personally, I usually don't take additional vitamin D in the summer because I'm more outside, and I think I'm relying more on my skin generating vitamin D. So I think question is critical. I think what I'll do is also in the future, in the next couple of months, I'll speak to that again as we get more data from other vaccines. If indeed the projections and optimism of the future is up, which is, those of you who listened to our president yesterday probably also gotten sense that the news are primarily more optimistic. So if we are continuing with that optimism and things that indeed look better and better, and the chances of us getting sick are going to rapidly decrease as more and more people get vaccinated, and the sort of what we thought would be an unobtainable goal of herd immunity may actually be a realistic goal, surprisingly, I would say, then, you know, I say that, you know, we could probably start easing out on some of the additional supplements we've been taking. Yeah, so I think Mark's putting a very good point. That's actually often what I do too. So I either don't take it all in the summer or take lower dose, and I take, personally, I take 5,000 units in the winter. That's my And I combine it with a high dose vitamin K2. I don't know if I discussed that, maybe one good topic for the future. Okay, that's actually, that Pfizer study was my main point of my wellness talk today. I also wanted to bring up a couple other things. I have starting to see young people getting vaccine in our area. Apparently, it's completely unpredictable. I had a good friend of ours who at age of, I think, 49, gotten scheduled for Friday. How? I have no idea. She basically was inconsistent. She's in Maryland. She lives a couple of blocks from where we are in Tacoma Park. So she was very consistent. She kept calling, and she got through. And they said, yep, we have a cancellation and you can come in. So that's really major difference, because formally Maryland has not started vaccination of everybody, but apparently there are opportunities. Those of you who want to get the vaccine, I guess I will investigate more how this occurred with this friend, with Ellen. But I think meantime, my suggestion is be persistent at contacting the standard channels, whatever the state you're in. And it sounds like a number of vaccines, especially now with Johnson & Johnson also available. Okay. Questions, right? We're good on time, 2:10. Good. All right. So Sheila is asking to address, oh, there's a question before that, right? Kaiser?
I got that one.
Oh, okay.
You can skip that.
Okay, good. All right. Efficacy of J&J in relationship, right? So at least for now, the efficacy of Johnson & Johnson vaccine is a little less. It appears to be quite effective at preventing mortality, but not as effective at preventing any symptoms, so even milder disease. I think it's in 70% protection versus both Pfizer and Moderna protect against any disease at around 90 plus, or like 92 to 95, depending on. So that's a significant difference, but at the same time, the protection against mortality seems to be quite high for all of these vaccines. It's a good news. I also did a very detailed analysis of what's in J&J, because a lot of people who work with me very concerned about thimerosal, and I do want to tell you there is no thimerosal, which is surprising to me. They use a very different, much newer chemical, which is a form of a complex polysaccharide based on cyclodextrin. I don't exactly remember the name, but if somebody is interested, I can put it in. I did look that up in detail. It looks like it has known toxicity. It's a carcinogen and also known liver and kidney toxin, but it's very dose related. And the toxicity has only been found at the very high doses in animal studies, and the dose that's in the vaccine is minute. Like literally, I would never suspect that to be problematic at the dose that's used. And it is considered to be a safe food adjunct to humans, and it's used in a number of supplements and medications. So it's already a substance, that type of cyclodextrin, that's already in the use. And again, it's at the trace amounts. It's basically uses the similar principle as the PEG in Pfizer and Moderna. It's an emulsing agent. So it allows for the vaccine to be spread equally through the shot. And other than that, there's some other chemicals. It is an egg-based. So if you're really severely allergic to eggs, I think there's a statement there. But beyond that, I was surprised not to see thimerosal in there, because it is a multi-vial injection. It's 10 injections in the same vial. That I wanted to share as well. Okay. Oh, I also want to address the Utah case. You guys have seen on the news the 39-year-old woman who passed away 4 days after the injection, who was completely healthy. And there's this whole anti-vax craze that's going all over the Facebook and internet. So I looked that up very carefully. So apparently she died from a sudden liver failure, which is really bizarre. I have a hard time connecting that to vaccine, to be honest with everybody. It wasn't an allergic reaction. Liver cannot fail as allergic reaction in 4 days. Sounded like she had a massive toxic reaction. I can't imagine why would vaccine do that. So I think it's premature early to connect it to the vaccine. There's been, of course, deaths after vaccine just because deaths occur, have nothing to do with the vaccine, right? So, but this you're gonna see all over the news because it's already all over the news. So just don't panic, I think, until more data is out. I would say it's almost certainly unrelated to the vaccine. Okay. All right, questions, right? I think we're doing well on time. For person who's deciding between the Moderna and Pfizer. Okay, let me just stop right there. Don't decide. Just go and get it. Honestly, I think the difference between those two vaccines is so small that it's really not just worth trying to pick and choose. Plus, I'm not sure the picking and choosing practically gonna work. I can't quite imagine how you would go about that. There are very few places in the area that do offer Pfizer. Most, that's just based on availability of freezers. Okay. Yeah, and yes, so idea is that the Moderna has more supposed to be stronger vaccine, but as you just saw from Pfizer study in Israel, the Pfizer vaccine is exceedingly effective. So it's hard to imagine something to be more effective than that. You know, I will tell you that generally speaking, if I take something like a flu vaccine, you never expect efficacy more than 60, 70%. You're lucky to get 50 in any given year. So getting a vaccine, Pfizer, being 92 to 95% efficacious, that's unheard of. I'm not aware of any other vaccine to have this degree of efficacy. Maybe polio. Polio, I think, has been 90+% persistently. But things like MMR, like measles, mumps, I mean, we're talking about somewhere around 80% for all the common vaccines that you've been getting, just as a reference point. Issues with blood clotting. Yeah, so the AstraZeneca got bad rep for few things, for clotting and for this unusual hemolytic problems in a very few selected patients with autoimmune blood disorders. Honestly, I have not investigated that deeper than that. We don't really have AstraZeneca. I feel like I'm not exactly sure why I would spend time. I have much more important time spending on Johnson & Johnson vaccine for practical reasons. And I have not known what's the update of AstraZeneca, but I do know it's been blocked from several countries. So that's not necessarily good news for them. But honestly, I'm not sure I can tell anybody more than that. Yes, so Benito, thank you. I think that's exactly how I feel. I think it's worth keeping an eye on the news and on upcoming studies like the one I just put in Israel. The reason Israel has all this data is because they vaccinated more than 50% of population by the end of January. So they simply have a time lead over us. So we'll have that same data coming out, but only in a few months from now as more and more people vaccinated. I guess having a single payer system pays out. What can I say? I lived in Israel for 3 years. I'm telling you, I know why that happened. It's communism without communism. I put it that way. I mean, their healthcare system is socialism, purely. I mean, they say what goes, it goes. You know, it doesn't feel like quite Russia, since I have comparison between all the systems, I can say. But it definitely doesn't feel like your typical American healthcare system over there. Any of you who've been to Israel, I think, would agree. There are pluses and minuses to everything. All right, I think we're good, right? So we're at about 20 minutes. My kids run out of the house, which is nice.
There's a question at 2:14 p.m. Can you answer that one?
2:14. Yeah. If one has been well nourished in the past but felt nauseated after second Pfizer shot for several days, didn't eat as well, still make a response to them and if the body. It's an interesting question. Would one still make? Yeah, I think so. I think the reason people get side effect, it has nothing to do with the response to the by forming of antibodies per se. I think it's because you have a foreign material injected, there is a immediate immune response, and it can cause this kind of side effects. I also feel like this is why several countries actually made a pretty strict regulation about not vaccinating people who are extremely frail, because the concern was that if somebody is within a few months basically on hospice and they all have less than 6 months to live, you may expedite passing by this exact issue. In fact, in the study in the nursing home in Norway, this is exactly what they found. People were getting nauseous and there were more deaths attributed right after vaccine because unfortunately they just were vaccinating indiscriminately without thinking about this. And once this issue started to surface, I mean, if a healthier younger person gets nauseous and doesn't eat for 24 hours, just drinks a little bit of water, nothing will happen. But if you're talking about somebody who's very, very frail, that may tip them over. So that's basically, I think, the thinking is here. So yeah, I don't think that the reaction will not be happening if you have this kind of side effects. So Elizabeth, I hope that helps. All right, and yeah, so again, as I said, I don't think that how you eat is necessarily going to make a major difference on how your body will respond to the vaccine. The antibody response is, you know, of course, if you're very malnourished, it may be different. And also in older adults, there is a lesser response. But we don't actually have data to suggest that somehow much older adults responding much worse than the younger adults to this specific vaccine. It has been seen in other vaccines. A good example is the zoster vaccine, the shingles vaccine. That vaccine is much less efficacious in people over 85. In fact, the not this recent, the vaccine that was used before, that's called Zostavax, that vaccine actually fell out of favor at some point because in people over, I think 75 or 80, don't quote me exactly on age, the efficacy was less than 50%. So at some point, guidelines was not to vaccinate people over a certain age with that. But we don't see that. In fact, there were a good number of 85 plus people who were included in the trials. There were not a lot of them, but there were sufficient to say that vaccine seems to be protective even for the old. I know there's been voices in immunology speaking against vaccinating 85 plus because of the lack of total number of people to make a really good statistical analysis on that. That's true, actually. But at the same time, there is no, in a small sample size that was 85 plus, there is no reason to suspect that somehow it's not effective because we have not, the same difference in 85 plus was seen as in much younger group. So. Thanks, Irene, for putting, everybody should read that comment. Wow. Yeah, it is totally wow. And first of all, wow, that your mom is 100. That's first of all. So, yeah, so exactly right. Thanks, Dr. Frame. So the stronger the immune system, the younger the immune system, the more side effects we see. So, you know, but again, that's the problem. I mean, we don't know if lesser immune response means you're totally not protected. The chances are you're still protected. You just maybe not as protected. A bigger question and probably more clinically critical question is the immune protection much shorter in an older adults? And I don't think we're going to have an answer to this question for, you know, I'm guessing months, probably not weeks, just because we're not going to have data until this kind of analysis occurs. But this is actually quite an important analysis for everybody. Like, how long is our protection going to last? Because we know for sure that COVID will not just sort of dissipate into oblivion over next months. It'll stay with us for long. Question is, at what point do we need boosters? Do we need them at all? Stay tuned. I don't have good answers. I don't think I would. I'm not even comfortable to have a suggestion. I've seen all kinds of expert opinions from left to right here, and I'm not ready to formulate my personal opinion yet until I see more data. Okay. We have a minute. Kathy, do you want to say what that reaction was? You mean you developed antibodies? Is that the point?
Well, I had flu-like symptoms after the first dose for about 3 days.
Mm-hmm. Yeah.
So I mean, not that sick, but it went through my body, you know, being, well, first started to be tired.
Mhm.
And then I had aches and pains and chills. And then I had my second shot and I was fine after. I had no reaction after that one.
Daniel, thank you, Kathy. Daniel, I see your question. I'll cover that, and let that be a last question. Before I go to the Mr. Silver, Dr. Silver's question, quick point. So I haven't done my statistics on my patients, but I would probably say 2/3 of my 65+ patients tell me they have some symptoms. Most of them are very mild. And I definitely for sure tell you that the protocol that I've shared some weeks ago definitely seemed to be helpful, because I had pretty much everybody who took it said that they've had either no symptoms or their second shot went a lot easier than the first. So I think I've been convinced from the beginning that this is histaminergic reaction, and I'm still standing behind this. And I know that the things that we do for histaminergic overflow, or, you know, are seemingly working and helpful. Okay, so the question here is air and train travel. I'm not sure if there was more to that. So let me see if I can find. Daniel, do you want to unmute yourself and ask exactly what the question was?
The question was just about whether there's anything new about air and train travel.
Yeah, so to my understanding, not much new. I think if you travel within US, you typically not required to be tested, but if you go outside to any US territories or abroad, you will be required to be tested before, you know, typically, I think within 72 hours before the travel, you'll be required, and if you to show the negative result. Otherwise, if you do travel, you're at risk of being quarantined for 14 days at your own cost in most of the locations. So just be aware of that. Other than that, I don't think there's anything new. I think you still should be socially isolating, wearing the mask, face shield during the travel, and that's all I'm going to say about that. And of course, you all heard the CDC recommendation, right, about if everybody's vaccinated in the group, that you don't need to wear a mask, which we already discussed even before CDC came out with the recommendation. But it's nice to be inconsistency ahead of time with CDC. That always feels good when you read the science correctly and CDC agrees with that.
May I just ask about the travel? So if one is flying cross country, would one still need to quarantine for 14 days before seeing anyone who's not vaccinated?
So I would say the following. That's why the point of testing. So if you get tested before and you're negative, I probably would not at this point, even though I don't think there's I think CDC recommendation is still to quarantine. If you haven't been tested, I would quarantine, you know, and the question is whether your travel was high risk or low risk. That's the key question. That's a hard question to ask. If you travel across the country, that's say 5-hour flight, and if you know you're going to have to take the mask off for drinking water, for example, you know, it's a little harder question because the risk is somewhat higher. Especially if you wear N95 and the shield, and you're not taking it off, I think you're quite protected, especially with all the planes now sort of double checking their HEPA filters. And the only issue is if the plane gets sit on a tarmac and they have to power it down for like de-icing or something like this, because then filtration system goes offline during that time, and that's a problem. And then you may actually be quite at high risk, and you probably heard of a few cases of spread in the airplane. But outside of that, I'd say, how do we test it for a flight? Great question. I'm so glad. Can I take another minute? I think I'm okay, right? Janet, you okay if I take another minute or two? So just a couple of things. So first of all, of course, you can always walk into CVS. Most of the time you will need a PCR. Do not do the antibody the rapid test. It's actually not designed for asymptomatic testing. It's really not a good test. It has a very high false positive rate in asymptomatic patients. It's almost 5 or 6%, meaning your chances of being positive, false positive, much higher than the real chance of being positive if you don't have symptoms. So the do PCR, and there's a couple of different ways you can do it. You can just schedule with CVS, and that's often drive-by. You just come by and they give you a kit, you swab your nose, you give it back to them. There's also LabCorp now has a direct test. So those of you who are interested should message me and I'll tell you how this gets done. We process it through the Center for Integrative Medicine. It's $50 for our time, but the kit is fully covered by insurance. So the way it works, we put the order with your information directly into LabCorp. LabCorp sends you a kit to your house, you swab your nose, you drop the kit into the FedEx, and in about 36 hours, you have a result. It's actually faster than CVS or any other lab. The holding point is when you order the kit, if there is a if something is miscommunicated, your address is wrong or insurance information is screwed up or whatever, you may not get a kit on time. So you have to give yourself, so if you're traveling, it's the best way because you want to get a kit, have laying there at your home for a week or so when you have exact 3-day bracket, and then you swab the nose, mail the kit back, and you're going to have a result before you travel. That's the best.
And Dr. Kogan will give me the link and information for the kit, and I'll include it in today's email.
Exactly. So you can just look up our website. I put it in the chat, and you can call us, and we will schedule you with one of our providers within usually 48 hours. So, but do give us a couple of weeks ahead because it's best to plan it about 2 weeks ahead in terms of timing. So, and you will save a couple hours this way because otherwise you're going to have to schedule with CVS, drive over there, stand in line, which usually quick, but still, so it's a little bit of time. So this is probably going forward for traveling will be the best option, the way I can see it. All right, and with that, I think I'm right on time. We're very excited to have our own GW Kimla, who's Kimla, you're now not in GW and you're not even in DC. So do you want to just say a couple of words about where your life is before you take us on the mindfulness journey?
Certainly. Well, spasiba, Misha, and thank you, Jeanette. I'm really excited to be taking part in this series. The work you do to get integrative medicine to entire communities that need it is incredible. So congratulations. Let me acknowledge now that the land that I am now living and working on is the occupied indigenous land of the Tiwa people, also known as Albuquerque, New Mexico. I'm grateful for the past generations of people who have taken care of this land and the indigenous communities that I live closest to, the Sandia, Santa Ana, Jemez, and Zia Pueblos. So yes, it's quite a change from Washington, D.C., but it's a beautiful place and you can see a lot of stars at night here. I tuned into the presentations recently and there's just a great continuity that leads to what I'm gonna share today. I've been involved over the years with both the Center for Mind-Body Medicine and the Thanksgiving Address, which were topics that were shared recently by Jim Gordon in February and by Luann Jacobs just last week. When I first moved to Washington, D.C. in 2000, my first job was with the Center for Mind-Body Medicine, which was a great place to work. We started every staff meeting with a short meditation period in silence. And also I've participated for about 30 years with the Tracking Project, where I have recited, here we go, the adapted Iroquois address to the natural world, that's known as the Thanksgiving Address. I've recited this many, many times with John Stokes, who's the founder of the Tracking Project. And he started that organization over 30 years ago. And one of the many things it does is publish the Thanksgiving Address in a small booklet. It's available in over 11 languages now, and it's been sent out all over the world. And he put the Tracking Project together because he believes that you can't really be closer to nature than when you're on your hands and knees looking at animal tracks on the trail. Both of my children went to summer camps that were offered by the Tracking Project in New Mexico, where they learned, among other things, not to be afraid to be alone in the wilderness, and also how to make a fire without matches. So good advice. So I'm also, as Jeanette said, a co-founder of a nonprofit organization. It's based in the San Francisco Bay Area, where I used to live, called the Cultural Conservancy. And this is a native-led nonprofit. And the mission of the Conservancy is to protect and restore indigenous cultures and empower them in the direct application of their traditional knowledge on ancestral lands. That's quite a mouthful. But one of our most recent programs is really a direct application of that mission. We recently were able to purchase a 7-acre parcel of land in Sonoma County, California, which is the ancestral territory of Coast Miwok and Southern Pomo peoples. And it's now the Federated Indians of Great and Rancheria. So on this land, we're going to be growing indigenous food and supporting native cultural practices and language and hosting local gatherings. And this is the kind of work we've been doing for about 36 years. So we're happy to share links to both these organizations if you're interested in learning more. Their work is really the inspiration for this meditation, this mind-body practice that I'll share with you today. And this practice, in terms of Western science, is really validated by recent research into physical and mental benefits of simply being in nature. We've probably all heard of forest bathing. In fact, I did a quick Google search the other day. I found over 20 books on the subject. There are probably more that have been published recently. I think the first time I heard of this was back in 1984 when there was a research report that looked at post-surgical patients in a suburban Pennsylvania hospital. It found that patients who had a view of a natural setting, trees and plants, through their hospital room window had shorter post-operative stays, they required less potent analgesics, and they had fewer negative comments in the nurse's notes compared to patients in similar rooms whose windows faced a brick wall. So somehow this is not surprising to me. And there are numerous more recent studies that have assessed the beneficial changes in blood pressure, heart rate, cortisol that result from contact with nature. And the research seems to show that these benefits occur regardless of whether the forest experience is in real nature or it's just through photos, videos, or virtual nature environments. In fact, there was an interesting study done in Italy during the early COVID-19 lockdown last spring and published last summer in the International Journal of Environmental Research and Public Health. And what they found in their trial was that 5 minutes of nature exposure in a virtual reality setting provided short-term restorative effects and positive benefits on psychological well-being compared to exposure to a virtual urban environment. Research has also shown that the volatile organic compounds that trees, especially conifer trees, emit are taken into our bodies and have actual effects on natural killer cells, which are linked to our immune system. So I think we all look forward to the day when providers like Dr. Kogan and others can write prescriptions not only for immune boosting formulas, but for a walk in the woods. And I honestly think Dr. Jim Gordon has been doing this for many years for some of his patients. So the practice I'm sharing today relies on this natural environment. It's an imagined one that you create in your mind or perhaps remember. And I would like to acknowledge that I learned this practice from another one of my teachers in the DC area who teaches through the Mindfulness Center in Bethesda. And his name is Mike Bosdavanos, and he's a Qigong master and a piano tuner, which is how I met him, but he's a wonderful teacher. So he taught me, he shared this meditation in one of his classes. All right, so thank you for that, listening to that introduction. And now let's begin. And let me just say again, in this meditation, I'm inviting you to visualize a place where colors of nature are really alive and vivid. It can be a place you visited and remember, or just any place at all that brings you a sense of calm and peace. So take a comfortable position, whatever's most relaxing. Most people seated probably. You can be lying down. Whatever position allows you to take a nice full breath. And you might want to close your eyes or soften your gaze. And I would like us all, if we can, just breathe in together, nice long, full inhalation through our nose. And a complete exhalation out through the mouth. Take a couple of more deep breaths just on your own time. And just completely drop into this present moment with these breaths. And feel your connection to the earth. Whatever body part is supporting you on the chair, feel your feet on the floor, really feel your connection to the ground. And let your breath just return to its normal calm rhythm, breathing in and out. And if you haven't already, close your eyes and look inward and just kind of notice the field of vision that appears in your third eye, kind of between your brows. Just notice that color. If there's a color in that field, there's no intention, just curious about watching what's in your mind's eye. And now with your imagination, imagine that you're looking across an open field in the late spring, so that this field is just full of new growth, grass and plants with brilliant greens of all hues. The particular plant draws your attention because of its deep blue-green color. Let your inner vision drink in that color. Just let it absorb it down into your body. Imagine the blue-green coming in at the top of your head and spreading down through your skull, your face, covering your ears, your neck and your shoulders, continuing down your chest and your back to the ends of your arms, into your hands and fingers, and on down through your abdomen and your hips, your pelvis, all down through your upper legs to your knees and your calves and your shins and your toes, all the way to the soles of your feet. Just sit for a moment in that blue-green color. And now you notice that the sun is setting and you see the sun. It's on the horizon, changing to this brilliant red ball, warming and soaking into your mind's eye. Let your inner vision be bathed now in the brilliance of the sun, and let this warm red light absorb into your entire body from top to bottom, as you did before. And now you can sit and relax a moment just within this red. And now as you look across the field, you notice that there's a forest of beautiful maple trees. And you see they're changing their leaves to this bright yellow color of fall. Let your inner vision drink in and absorb that autumn yellow into your whole body. Let the warmth of a golden autumn day and these yellow leaves be you as you relax for a moment in this color. And as you gaze at the trees, you notice that around the roots of the trees are small drifts of snow heralding the coming of winter. This pure white snow, it's sparkling like it's made of tiny clear lights. Let this pure white brilliance come into your mind and body, and feel its clarity filling you from head to toe. And just let go and just be for a moment in this pure white light. And finally, at the edge of the field, just beyond the maple forest, you see a brook. You see some moving water flowing and shining with a bright blue color. Let the moving waters of this stream run through your vision and absorb this reflection of the blue sky into your body. Let it flow down like the water from top to bottom, and just sit for a moment in that blue. Now, I'd like you to take one more deep breath in through your nose and out through your mouth. And say goodbye to this beautiful wooded meadow and its plants, trees, and waters, and any animals or insects or birds that you may have encountered in your imagination. And in whatever way is meaningful to you, send your greetings and thanks to this place. And you can open your eyes. Thank you. I hope you enjoyed that.
Thank you, Kimla.
You're welcome.
Well, we're a little ahead of time. I guess that's a good thing. It's always hard to come back from practice after that.
Yeah.
But if anybody have more questions, and then we also have some updates that we need to give, but we have a couple of minutes that if anybody else. Yeah, Elle, go ahead with your question. If you want, you can just unmute if you prefer. I guess not. Okay. Oh, yeah. So the forest bathing information.
Can I ask one question before you go
Yeah,
there?
sure.
I put it in on the chat. I'm really confused. Does that mean if we didn't have reaction to the vaccine, does that mean we don't have immunity? Or?
No, not at all. No, absolutely not. Okay. So if you did not have a perceivable reaction, it means nothing in terms of whether you have a response to reaction or not. Okay. So it's not in fact, I don't think there's any correlation between side effects and the protection of the vaccine. You don't need to sort of be worried about that. Okay. Again, I see those as two separate, they're two separate immunologic mechanisms. I think the allergy, or that's not an allergy, but the reaction to the vaccine when people have fatigue and all that, they're probably mostly histaminergic reactions. That's how I see it. But formulations of antibodies has very little, it actually has nothing to do with histamine per se. It's a much more complex T-cell regulated reaction that body produces. And why we have, that's because we have both. There's two large branches of immune system, what's called Th1 response and Th2 response. And one is mediated through this kind of immediate mast cell release of triggers, so to speak, and the other one is a purely antibody-mediated process, and they're parallel. They're important both because they protect us slightly different. And one is thought to be more an allergy-like reaction, which is the histaminergic response, and the other one more cellular reaction, which is the more antibody-based. Okay.
Yep.
Does that help?
Thank you.
Sure.
Thanks.
I also want to post something. Am I posting? Is this right? No, not that. Sorry. I was trying to. I just found something really.
Dr. Kogan, can I ask a question?
Sure.
It's Benita. Question: if we received the first dose, so I had Moderna this week, and the side effects were god awful. Does that mean that I could possibly have had COVID?
That's a really good question. So your question is this: if I didn't know that I had COVID and I have antibodies and I got this shot and my reaction is strong because I have I may have had an, that's the whole point of why the CDC recommendation is not to vaccinate anybody after COVID for at least a month. Even though a lot of institutions don't follow that recommendation, they just vaccinate immediately. Yeah, that's actually not impossible, I must say. Chances are that's not the case. Chances are you simply just had personal strong reaction. My wife had pretty strong reaction. I know a lot of people who had strong reaction.
My reaction was pretty strong. Like it was just the awful arm, plus then the headache, plus then the chills, and then like yesterday, 2 days later, severe back pain.
Mm-hmm.
And I had not read anything about back pain as like a side effect. Even the VAMS check-in that they've been doing every day,
Mm-hmm. Yeah,
there's been nothing about back pain. 2
patients with different pains after the vaccine, unrelated to the site. I mean, I had everybody have sore arm. Did you take the protocol?
Did I take the protocol?
I'm sorry.
I've just been taking zinc and I've been taking
No. Did you
and
take the vaccine protocol?
Which vaccine protocol is this?
You missed that presentation, unfortunately. Why don't you send me a personal message, because we have a special prep that seemed to work. You should be a priority prep, because
thank you.
For the second injection, your reaction will be worse if you do nothing, chances are. So let's do the prep for you before you do the second. It's a 24-hour prep before. It's not it's pretty simple.
I'll do anything. Thank you.
So I just want to not forget what I posted in the chat. This is my, Kimla, this is my favorite resource for the forest bathing. And of course, we had such a privilege of Sage giving us, well, can't really call it forest bathing, but those of you who ventured out when he was in the botanical gardens, arboretum, that worked. But so yeah, this is actually a company that started by somebody I know. It's a nonprofit that basically helps doctors and patients to connect to parks to do forest bathing. And the idea here is because a lot of people in areas where there's just not enough greenery, you don't even know where to go. So the idea here is this is a kind of a collective effort to post information as to where parks are in every community, regardless of whether it's, you know, Anacostia or North Bethesda, you know. So idea is that you know, we should be able to identify the green spots quickly. And also this is also connects to physicians. So if physician signs a affiliate account, they can actually prescribe forest bathing by creating the prescription and sending it to patient's email. It's pretty cool.
Yeah, that's excellent. Yeah. And if you can't get out, you can watch a video, apparently, that's, you know, similar benefits.
Yeah, well, maybe we'll come back to that. I think, I don't know, Janet, if Sage is back on our schedule, but you know, we'll do that.
Sage is scheduled for May, I believe.
Perfect.
Yeah, and there's also a reference that I included in the chat for natureandforesttherapy.org. They have a lot of you know, kind of background information on that. That's great. I'm glad to know about Park RX.
Okay, I think it's good timing. We have an update, so I'll have Dr. Frame lead us into this quick update in the last couple of minutes.
Hello, everyone. That was such a wonderful practice. We have an update. I think that's a good way of putting it. We have been working now for 3.5 years as the Office of Integrative Medicine and Health, and we have operated on the generous support of donors, and we've been trying to get a few foundations to come in, but with COVID, we've hit upon some obstacles, and as of today, if nothing changes, the office will be closing at the end of May. And that does mean, unfortunately, that Janet would lose her job. So we are doing everything in our power to stop that from happening, but we wanted to let you all know that obviously this event would no longer be able to be supported by the office because it will not be here anymore. We will not have Janet. So that is the update. It's not a fun update, but like I said, we are trying to find some funding to help support us, at least for a few months, because we have a lot of things coming down the pipeline that will help support us, but they're just not going to get here in time for us to continue. So now we're looking for some stopgap measures.
Yeah, and I mean, the other thing is just planning for all of it. If indeed we don't get funding, we really still want to try to keep this program running. And as much as Janet has been, I don't know how my life will go forward without Janet work-wise. I really
agree.
but you know, we want to try to maintain what we can. So we may need, if it comes to that, we may need a volunteer or two, or maybe even a couple of people to try to run administrative component of these meetings, which basically
you'll need a couple of people.
Yeah.
I say at least two to.
And the call for that, I would say, is immediate, because one of the stopgap measures we're doing to try and save this for a little bit longer is to put Janet to 50% effort, which means she won't be able to run this event. So immediately we do need volunteers to help run this event. So if any of you are available, we would absolutely love to have your support.
And Janet will, of course, onboard you on what is needed. Janet, do you want to just say a couple of words as to sort of what the kind of scope of this work is for you?
Sure. We are always looking for new people to come and give the wellness talk, and also new people to do the mind-body practice, but also keeping connected with the folks who are kind enough to give us their time and bring them back again and again. So that takes some time to do. We also promote the event on social media. We have to send out emails to you all. We send out 2 emails a week, one to remind you that this is happening, and another to share any of the information that comes out of each gathering. And also you have to record and edit the video and then upload it to the AIM YouTube page. So that's pretty much the scope of the work for this project. And wrangling Misha.
Which isn't that hard. He tries so hard. One of you actually just gave me a good suggestion. If any of you are connected to any small family foundations that may be willing to support us, I would really appreciate that. We've been working with larger foundations, but as you all probably realize, they move kind of slowly, which is part of the issue. Is we have some things that are in the works, but it's not going to get here in time, and maybe not even for a year. So we don't have anything to cover us in the meantime. And yes, you can email Janet if you have any questions, suggestions. You
can also email me directly if it's easier for those of you who know me more. Kimla, unfortunately, the university, the way it's structured, well, Lee can talk more about that, but the way it's structured is each office has to basically fundraise individually. And so university offers infrastructural support, but for the staff salaries, there has to be a budget that is separate, I'm afraid, right? Am I sort of?
That's correct. And I always look at it this way: is the office is run by Janet. So that's the most important thing that the office has. And that is the part that is funded through donations. My salary obviously is supported by the university. Dr. Kogan's salary is supported by the university.
Actually, my salary comes from, just with everybody on, is from Medical Faculty Association. So this is a Docs Incorporated entity. So my salary comes from there for me seeing patients on campus. But
so that is now under the School of Medicine and Health Sciences.
Oh, is it?
Yes, it is. Because Dean Bass took over the MFA.
It's so complicated. I can't keep up with the politics of.
They're trying to make it less complicated.
That's actually sounds really good, because before there was a separate pocket for everything. Now
yes, it was too complicated. Yes.
That makes it easy. Lee, there's a very concrete question, and I also answered a similar question. privately, sort of what are we need for the next 6 months in terms
So
of
this is where I can actually blow your mind. Our office is a lean, mean fighting machine. We operate entirely on $130,000 a year. That's absolutely everything we do. Which, yes, Kimla, your reaction, that is so low. And part of it is because we're so committed and excited to be doing it that we're, Misha and myself are donating a lot of our time. Janet works so hard and has gotten really good at the things that she does. So for 6 months, if we had, even $50,000 would be amazing, and would make sure that we're still here.
Yeah, it'll definitely carry us over. And as Dr. Frey mentioned, we have multiple projects in a pipeline. It's just like, give you one example, we had a randomized clinical trial ready to go, but we just can't get through the contract. Each step at university is like, I thought that I grew up in the most bureaucratic society and I came here and everything is just, you just blow and it happens. Turns out, I guess, all the bureaucracy, universal problem. But we're struggling just to get through the standard processes within institution for the paperwork to finish before we can get paid. So it's sort of like there's several projects are in the pipeline like this, but it'll be just sad if we have to, close doors, so to speak.
Correct. Agreed. And we've accomplished a lot in 3.5 years, and I feel like we have some good momentum. So we don't want to lose that momentum.
And Sheila, yes, that is correct. We can accept donation towards the salaries.
Yes, we can.
Correct.
And you can even note it just for that.
Where do you give donations to?
So actually at the bottom of the emails that Janet sends you, there's a link right in there.
Just don't pick AIM. You got to pick Office of Integrative Medicine. Don't worry about the AIM for time being. AIM is operating because Janet is here. So
yes, we are actually operating on behalf of AIM here as well.
And AIM, just for full disclosure, AIM is getting a couple of grants. So there's one small grant to start breast cancer groups. And also we have a scheduled meeting with the largest DC Medicaid provider next on 17th to sort of resurrect our contract conversations. But that's really separate from Office, because that's AIM. The difference here is AIM is a purely clinical entity. It's supposed to do some education and some training, but education traditionally has been done almost exclusively through the Office of Integrative Medicine, which is what this component is today that we're doing now. But the core principle of AIM was to figure out how to deliver holistic integrative services to Medicaid population, basically. So that's a core principle. And the AIM I wouldn't say went under, but AIM lost all its funding at the beginning of COVID, and we're just starting to sort of gradually bring things back. But AIM has not had staff for a year. So we're quite realistic that we can't just suddenly out of blue get a large grant to rehire people. So priority is definitely the Office, because Office has been sustainable and, well, sort of.
Well, we were given a gift of funding that was supposed to last for about 2.5 to 3 years, and we've been here now for almost 4. So, or actually, no, over 4. You started in 2015, Janet?
No, the office, I started with the office in 2017.
2017. So yes, it's been 4 years, a little over 4 years. We were able to stretch that funding for, and that's all starting from nothing, right? No momentum. So it should get so much easier. In fact, it is already getting so much easier from here on out. But like I said, we're just kind of we're in a bureaucratic holding pattern.
And, the other big point here is we didn't realize that the money would run out this quick. We thought we had more time.
Yes, we did. We thought we had significant more time, and I got a notification from our financial director that the way certain things have worked out, that the burn was faster than we had originally anticipated.
So could you get back to the donation to who do we donate again? Not AIM, but to?
So the GW Office of Integrative Medicine and Health. And I believe Janet just put a link in the chat that should take you right there. Is that correct, Janet?
Yep. I think it's right straight to the office.
Correct.
And there's all kinds of Office gifts and all that. So you just
Oh, that's an interesting question. Is the office eligible for PPP? I don't know if they're still doing that. Are they?
No,
Yeah.
they are, but I'm sure office is not, because office is a part of the larger administrative system. And
Right.
the CIM got 2 rounds of PPP. So it has to be a centralized ask, which I'm sure university is getting. I'm also quite sure that office is probably getting nothing out of that.
Correct.
Because there are bigger fish to fry within the university's scope of services.
Right.
It is what it is. Yeah, Benita, yeah, university, I'm sure, gotten every PPP or every whatever support they could. I actually think that larger nonprofits like this are probably getting separate protective mechanisms that are much bigger than standard PPP.
Yeah, I do know that GW received funding, and I also know that it basically went to cover all the different changes on campus that need to be done to make it safe, so that when our students come back in the fall, we won't have to worry about this. And I know like every building is getting all new ventilation, because all of university buildings are old and they have very bad technology, and they were basically a mini pandemic waiting to happen. So now those ventilation systems being replaced, our students will be safe.
Well, also like they test all the students every week, I believe, or every other week. So there's
Well, and the faculty and staff as well. Yes, all that testing is expensive.
Yeah, they actually, I know that like they just closed whole sections of some buildings to sort of reroute and reorganize the workforce to accommodate for all this. It's a massive infrastructural shifts, which are, of course, come at a substantial expense. Yeah, we've all been affected one way or another. And even if you feel like you're not seeing that effect, it's pretty obvious. And, I think Mark spoke very elegantly about this last week when he talked about how different the impact was or is on New Zealand. And I think if we all look into our own microcosms of our lives, we'll see that we have been affected so much more. And I think at the minimum, acknowledging it and doing our best is sort of what we can do, or the only thing we can do. So,
well, I think that's a beautiful way to end, Misha.
Yeah. Well, I wish we'd end on a somewhat more positive note, but it is the reality. So.
That's right.
Thank you.
And thank you all.
Thank you. Thank you for sharing, and hopefully there will be a resolution.
Yes, keep us in your thoughts.
Mm-hmm.